Now let's perform the examination of the sensory functions and the reflexes. To assess the sensory areas of the upper and lower extremities, take a sharp end of a swab and ask the patient to say yes if they can feel the sharpness of the pain.
Yes, 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 yes.
Now take a cotton wisp and look for the sensory areas of the upper and lower extremities. Ask your patient to say yes when they can feel the swab on their body.
Yes, 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 yes.
Now let's test for the vibratory motions of the upper extremities. For this, tap your finger on the heel and place it on the phalanges and ask your patient whether they can feel the vibration.
Yes.
Repeat it on the other hand of the phalange and also on the trunk of the shoulder. Tell me when you can stop this vibration and your feedback. Can you feel it?
Yes. Yes.
Test position of the lower extremities, the deformity of the fingers. Also continue it on the upper phalanges. Pull them against resistance. Now let's perform the stereognosis test. Stereognosis is the ability of a person to identify an object by touching. I am giving my patient a few objects and ask him to identify what it exactly is. Close your eyes. Can you say what it is?
Coin.
Okay. I am giving you some other thing. You tell me what it is.
Coin in different size.
Different size? Okay. Now let's perform the Grasset-Theria test, which is the ability of a person to identify what they are be written in the hand. Now I am going to write few numbers in the hand of my patient and ask him what it exactly is. Can you show your hand? You tell me what number I am writing. Close your eyes.
4.
Okay, that hand.
5.
Okay. Now let's perform the 2-point discrimination test. To perform this test, you need a sharp object of 2-ended. Place it on your patient's finger and ask them to say whether it's 2 points or just 1. Let's start. Close your eyes. How many can you feel?
2. 2.
Here. Now shorten the distance and try it again.
2.
Okay.
1. 1.
Let's perform the point localization test. To perform this test, ask your patient to close their eyes and touch on a place, and then ask them to open their eyes and ask them to point out the position of where you have touched them. This test is used to find the sensory loss at the trunk and lower extremities. Let's start with it. Close your eyes. Open. Can you show where I touched you? Okay. Now let's perform the double extension test. This test is usually helpful in the presence of the sensory loss. To perform this test, take both your hands and place it against the stimulus of your patient and ask them to identify how many fingers you have used to touch them. Close your eyes.
2. 1. 2.
Okay. Now let's perform the test for the deep tendon reflexes. To perform this test, keep your patient hand in a resting position and contract the biceps arm and strike with a hammer on the hand of you. Strike it against the muscles, bicep muscles. Repeat it on the other side. You should feel the contraction of the biceps muscle. Now let's test for the triceps reflex. To perform this, pull your patient's arm, shoulder towards the front, bend it, and strike on the behind the elbow. Now let's perform the test for the supinator reflex. To perform this test, relax the patient's arm and then ask them to relax it this way and strike the wrist with your hand, and using a reflex hammer strike on the radial nerve and look for the reflexes. Now let's perform the knee reflex test. To perform this test, flex your patient's leg forward and locate the patellar tendon and strike it again as the knee. To assess the reflection of the both sides of the knee reflex, place the knees upward and strike on both sides. Now let's test for the ankle reflex. To perform this, flex the patient's ankle and just strike on the Achilles tendon to feel the reflex. Also repeat it on the other side. Look for the contractions of the Achilles tendon. Now place one leg on the other using a dorsiflexion and strike on the ankle, on the Achilles tendon. Also repeat it on the other side by dorsiflexing and striking on the ankle and the Achilles tendon. Now let's test for the cutaneous reflections. To perform this, take a sharp edge of the swab and just strike it on the patient's below the umbilicus. Look for the contractions of the umbilicus on the upper extremities. Flex the patient's head towards the front and tell them to put no resistance. Make sure the chin touches the shoulder and look to the upper and lower extremities. If in a normal patient, they should remain in resting position. To test the positive radiculopathy, lift the patient leg, flex it to the up and also dorsiflex the knee. Look for the radicular pain and dorsiflex it to 90 degrees and look against resistance and look for any radicular pain.